Prime.
And thank you for joining us tonight. I'm Natasha Zubest. We do want to start with that breaking news from today from the World Health Organization, formally designating the worldwide monkeypox outbreak as a, quote, public health emergency of international concern. This decision coming as the virus spreads in 75 countries, including right here in the U.S., where the CDC just identified 2 cases of the virus in children, one a toddler, the other an infant. NewsNation correspondent Joe Khalil is tracking tonight's breaking developments and looking at the response here in the U.S. Now, Joe, the WHO took this extraordinary step, but it was not unanimous.
Yeah, that's right. And it is a big deal, Natasha, that they made this designation. Look, when we all went to bed last night, the World Health Organization only designated 2 diseases as global health emergencies right now, COVID and polio. Well, as we woke up this morning, as you mentioned, they added a 3rd, obviously monkeypox. And so now there's greater urgency to try to get control of this disease as it spreads now to 75 different countries.
Monkeypox is now a global health emergency. That rare declaration coming from the World Health Organization Saturday. WHO Director Dr. Tedros Ghebreyesus said it wasn't an easy call. The committee who makes that determination was split. But it means now WHO member nations will provide more funding, more resources, and coordinate on vaccines and treatments, hoping those measures will slow global transmission. The WHO says the vast majority of growing cases are among men who have sex with other men. Here in the U.S., there are nearly 3,000 cases, almost a 3rd in New York alone. California, Florida, Georgia, and Illinois all show case counts higher than 200. The White House and the CDC are facing questions about whether the level of testing they're doing now is enough and whether they were caught flat-footed.
But there's one key important similarity with COVID and with monkeypox, and that is CDC's inability to see the data in real time.
During an interview with NewsNation's Leland Vittert last week, Dr. Bob Lahita pointed out the U.S. bought more than 1 million doses of a vaccine from Denmark before it was inspected and approved by the FDA.
The European Union said, well, this vaccine is safe, and the FDA still said, we're not going to approve it.
The White House did release its strategy on monkeypox in June. The CDC scaled up testing, opening 78 sites in 48 states. It includes shipping out nearly 300,000 vaccines around the country immediately, with plans for 1.6 million more over the coming months. And the agency's working with labs to produce tens of thousands of tests every day.
Now, the CDC director, Rochelle Walensky, says there are comparisons people are making between monkeypox and COVID, but she says these are very different viruses. Obviously, with monkeypox, we already have a successful vaccine. And again, it's mostly in this community of men who have sex with other men. We did learn about those 2 children that got diagnosed with monkeypox, but those cases, Director Walensky confirms, were also actually traced back to gay men as well. Natasha?
All right, Joe, we appreciate the update. Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.